Good day everyone, my name is Raquel Hatulan, a first-year student nurse at Davao Doctors College. I am from Section 11C and my Energy 105 RD group is Group 11. The procedure that I will perform is the Thorax Assessment. We do this medical procedure to see if there are abnormalities in the respiration and in the breathing patterns of our patient. Before meeting the patient, I have to review her medical records in the doctor's order sheet. However, in the case of my patient, I don't have her medical records and I also don't have an order sheet of the doctor. So we are going to skip that part. My assessment is going to focus on the thorax, including the lungs. So the equipment that I would need are my stethoscope, gloves, marker and tape measure, and the patient's gown. Before I do the assessment, I have to perform hand hygiene to prevent the spreading of germs and cross-contamination. I also have to put on my gloves to reduce germ dissemination and contamination of body fluids between the patient and I. Good morning, ma'am. I'm Raquel Hatulan, a first-year student nurse at Davao Doctors College. I will be assessing your thorax today. Before anything else, can you please tell me your name, age, and birthday?
My name is Rihanna Domingo and my age is 20 years old and my birthday is February 22, 2001.
Okay, so I asked those questions to confirm your identity and to be sure that I have the right patient today. Okay, ma'am. How would you like me to call or address you during our assessment?
Rihanna.
Okay, thank you so much, Rihanna. Okay, so I had mentioned to you a while ago that we will be assessing your thorax. So for that, I will assess your posterior and anterior thorax. So by that, I meant your front and back chest, including the lungs. Okay? So for this assessment to be successful, I will request you, it's very important that you follow my directions and then you cooperate to what I am going to say. So I will have to ask you to remove your upper clothing later, and I will provide a patient's gown. Okay? And also, I will have to touch some of your body area so that I can feel if there are abnormalities or not. Okay, is that okay for you? Do you have questions? Do you have clarifications? None? Okay, thank you. Okay, I would like you to know, Rihanna, that whatever happens here will remain confidential to protect your privacy. Also, I will only share our findings here with other medical professionals that have something to do with your health if we see abnormalities. Okay? Is that okay with you?
Yes.
Okay, so I'll be right back. I will just have to close the curtains and the door to ensure your privacy. Okay? So I am doing this to ensure the privacy of my patient, to provide comfort to my patient, and to keep our assessment away from distractions. Now we move on to the working phase. As you can see, my patient is now wearing her patient gown and also she has wore her mask so that later it can cover her face, and also I tied her hair so that I can inspect her properly. So now that we have moved to the working phase, it is now time to survey her chest and also her respiration. Okay? So what I am doing now is that I am observing the color of her face, the color of her lips, the color of her fingernails. to see if there is a respiratory distress. Okay. How about this part po? The face, the lips, and on the chest. So now, I am also observing the color of her chest. This is also related to see if she has respiratory distress. Now that I'm done with the observation, I am now going to palpate her suprasternal notch and to see the location of her trachea. Okay, ma'am, can you please, okay, just sit straight for me, and if you could bend backward your head slightly. Okay, that's enough. So I am going to palpate her suprasternal notch to note the position of the trachea. Okay, I'm going to palpate now. Suprasternal notch, I have palpated it, and we are just going to Now we move on to the examination of her posterior thorax and lungs. So as you can see, I put my patient in a standing position so that I can properly observe it. Ma'am, can you please put your hands on your side? Okay. So now I'm just observing her scapulae and also the configuration of her chest wall. Now we are inspecting the spinal alignment for deformities. So she is in a lateral position. I mean, the back is in a lateral. We are inspecting in a lateral position to see if there are curvatures in the cervical, thoracic, and lumbar. So now I am going to ask my patient to bend forward so that I can see the curvatures. Okay, Rihanna, can you do? Okay, we're going to do this. Can you move here so that you won't bump the chair and do it this way? Can you do this? No, that's fine. Okay? Bend, 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 bend. So, I asked my patient to bend her waist like this to see if she has lateral deviation in her spine or scoliosis. Okay, can you please bend further? Okay. Oops. So, put your knees straight lang po. Okay, then. Okay. Bend more pa, ma'am. Okay. So, as you can see, we are observing, we can see that there is a lateral deviation in her spine. So now my patient is back in a standing position because I am now going to assess the temperature of her posterior thorax and also its integrity. I am also going to palpate it to see if there are abnormalities, if there are bulges, and also if there are tenderness. Okay, so ma'am, Rihanna, just tell me if when I touch your back, there are parts that hurt. Okay? Can you please here for me? Okay. Does this hurt? How about this? Yes. Now I'm going to see the respiratory excursion by palpating the posterior thorax. So I will put the palms of my hand on this part. And I will ask my patient to take a deep breath. Okay, can you please move in the middle for me? Okay, so ma'am, just take a deep breath. I'm going to ask you to inhale and exhale. And I will observe my hand if there is a lag in movement. Okay? Inhale. Exhale. Inhale. Exhale. Inhale. Exhale. Okay. Again, ma'am. Inhale. Exhale. Inhale. Exhale. Inhale. Exhale. Okay, thank you. Now we are going to palpate her posterior thorax using my finger, the fingertips of my palm to inspect the vocal fremitus. Okay? Please face that side for me, ma'am. This side po. Okay. Okay. So, ma'am, once I palpate some parts of your posterior thorax, please say blue moon. Okay? I will instruct you to say blue moon.
Blue moon. Blue moon. Blue moon. Blue moon. Blue moon.
Do it again.
Blue moon. Blue moon. Blue moon. Blue moon. Blue moon.
Okay. Please stand straight for me, ma'am. I'm going to repeat what I did to clarify my first observation. Okay?
Blue moon. Blue moon. Blue moon. Blue moon. Blue moon. Blue moon.
Okay. So, ma'am, now I am going to compare your vocal fremitus on both lungs. So I'm just going to use one hand po in palpating your posterior thorax. Okay? So just say blue moon once you feel my hand. Okay?
Blue moon. 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 Blue moon.
Thank you. Now we move on to the percussion of the posterior thorax. Okay, Rihanna, please bend your head and then your chest, put it like this. Okay. So I asked my patient to do this so that the scapula will separate and then also the lung tissues will be exposed to percuss. Okay? Can you please face this side? Okay, very good. So I'm going to start percussing now. So as you can see, I'm percussing on this side and also on this side. So we do that so that we can observe the sounds in both sides. Then please. So now we are going to percuss the lateral thorax from the axilla until the 8 ribs. So please, if you face this way, and if you can raise your hand up, please, not just cover this. Okay. So we're going to start from the axilla up to the 8th rib. On the other side, please. Face this. From the axilla and then to the 8th rib. Now we move on to the measurement of her diaphragmatic excursion. So, for this one, I have to palpate. I need to percuss her posterior thorax using this finger, using only this, the middle finger. And I'm gonna observe, I'll have to see where is the dullness in each side. Okay, ma'am? Liana, please bend like this. Oh, not too much, ma'am. And breathe out. And while you breathe out, please hold your breathe out. Okay? Breathe out means exhalation. Okay, 1, 2, 3, go. Inhale first. And breathe out. Hold it, ma'am. Okay. Exhale the dullness. Okay. So again, to see the dullness for the inhalation or inspiration, I have to do the same thing again, but this time my patient is going to breathe in. Okay, ma'am? Breathe in and hold it for a while. 1, 2, 3, go. Breathe it out now. So we are done with this side. Now we are going to do the same thing on this side. Okay? Ma'am, again, breathe out for me. 1, 2, 3. Hold it. Okay. Please breathe. It's okay. Okay. Now inhale. 1, 2, 3. Thank you. And we are going to measure it. So I have already measured it. Now we move on to auscultate the breath sounds. Okay, for this one, I am going to use my stethoscope now. And I am going to start to position it on the apex of my her lungs at C7. Also, I am going to observe her breath sounds on both sides. Okay, Liana, please just breathe for me, and breathe in and breathe out, and inhale and exhale so that I can observe it properly. Okay. 1, 2, 3, go. So now we auscultated her breath sounds. We already did the auscultation for her breath sounds, so now we will proceed to the auscultation of the voice sound. So the first one will be the bronchopony. For this one, I will have to ask my patient to say 99 every time I auscultate the parts of her thorax. So it's the same with the breath sounds. I will auscultate both sides. Okay? Liana, please say 99 as you feel the stethoscope.
99, 99, 99, 99, 99, 99, 99,
The second one is called egophony. So for this one, you have to say letter E. You just have to say E, okay? Each time you feel the stethoscope, okay? The same procedure will be done.
E, 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 E,
For the third one, it is called whisper pectoral key. Okay, so for this, the patient will have to whisper 1, 2, 3. Okay, ma'am? Just whisper 1, 2, 3 as you feel my stethoscope. Okay? So, those procedures are for our posterior thorax. Now we move on to the anterior thorax since we are done with the posterior thorax. So, right now, I am just going to inspect her interior thorax. Okay, Rihanna, please place in front of me. Okay. So, I am inspecting her breathing pattern through my eyes and through my ears. So my eyes are just gonna observe, and also my ears are going to be used for hearing her breathing sound. Also, I am observing her or inspecting her costal angle and the angle at which the spine enters the ribs. Now we move on to the palpation of the anterior thorax. Okay, so for this one, we are going to palpate to see if there is tenderness, and also to see the sensation and other abnormalities if there is any. So I will start with her left clavicle and then transfer my hand to the right clavicle. So I will do this systematically downward. Now I am just going to repeat the palpation, but I am going to use the crepitus and fremitus pattern. Okay? So, start here. So as you can see, I skipped the breast part during the palpation because our patient here is a female. But for males, it's okay to not skip it if it's possible. We move on to the palpation of the anterior thorax for the respiratory excursion. So for this one, the palm of my hands are gonna be placed. We're going to place on this part, okay? And then I will ask my patient to inhale and exhale to see if the excursion is symmetry. Okay, please inhale and exhale for me. 3, 1, 2, 3, go. Okay. Now we move on to the percussion of her anterior thorax. So the percussion of her anterior thorax should be systematic. So in order for it to be systematic, we're going to follow the sequence for the percussion of the anterior thorax. So we are going to start above the clavicles. Okay. Okay, so I'm going to skip the breast part of my patient because it might be uncomfortable for the patient, especially that she is a female. But in some cases, you can choose not to skip the breast part. So I am going to proceed on the lower part of her breast. Okay. Now we're moving on to the auscultation of the anterior thorax. So for this one, we're going to do this to observe the breathing sounds and also the voice sounds. So the first one that I will auscultate is her trachea. Okay, so ma'am, Rihanna, can you like bend your head like this? Okay. So since I'm going to auscultate that trachea, this part. Okay, just breathe normally. Now we move on to the auscultation of the anterior thorax. So we are done a while ago with the auscultation of the trachea. And now we are moving to this part. So for this one, I will be following a sequence. The sequence that I will follow for the auscultation is the same sequence that I followed during the percussion of her anterior chest. And I will also ask Rihanna, my patient, to breathe through her mouth, because this is to avoid the transmission of sounds through nasal breathing. Okay, Rihanna. So once I auscultate your anterior thorax, it is important that you breathe through your mouth and not through your nose. Okay. Just inhale and exhale for me, but use your. Okay. So now I am going to start. Go. Okay. So I am done with that, but I am going to repeat the procedure so that I will be sure and I can be more focused on the sounds that I'm going to hear. Okay, so I'm going to do the procedure, ma'am, and it's important that you breathe through your mouth again. It's okay if you use your mask. Okay, just breathe through your mouth. Okay, I'm doing it. Okay. Inhale, exhale from your mouth. Okay, and we are done. Okay, Rihanna, now I have the summary of your thorax assessment. During the examination of your posterior thorax, meaning the back part, I have noticed the lateral deviation of your spine. So it means that it is not symmetrical. So it's like the symmetry of your back shows a sign of scoliosis because it was not vertically aligned. Okay, so that was my observation. Okay, so however, during the palpation, we found no abnormalities and no movements when we palpated your posterior thorax. Okay, and for the respiratory excursion, there was no lag movement, so that was normal. Okay, and for the palpation of the thorax for vocal Formicos, it was heard most clearly at the apex of the lungs. So apex of the lungs is like the top of the lungs. Okay, so that was also normal. And when I percuss your posterior thorax, remember when I did this, percussion noted resonate, so that was also normal. And for your diaphragmatic excursion, when I did this, and I asked you to breathe, to see the difference between my thumb, that was called as the diaphragmatic excursion. It was normal and symmetric expansion because my thumbs, it separated 3 to 5 centimeters during the examination. Also, when we auscultated your breath and voice sounds, when I used my stethoscope for your posterior thorax, it was a vesicular breath sound. So vesicular breath sound is actually considered normal. So that was normal. And for your anterior thorax, when we say anterior thorax, it is the front part. Okay? When we inspected your breathing pattern, it was an effortless respiration, so that was normal. So it means that you were not struggling. Okay? When we palpated your anterior thorax, there was full symmetric excursion and there was no tenderness. And you were not saying that something hurt naman, di ba? Okay? For the excursion of your anterior thorax, there was also full excursion. So when I did this, it also showed a normal finding. And when I percuss your anterior thorax, percussion notes are symmetry. So there was no abnormal findings. Okay? And when we auscultated your anterior breath and voice sounds, my observation was the broncho-vesicular sound for your anterior thorax. For this part, it was a broncho-vesicular and bronchial sound for the trachea. So for this one, I observed a bronchial sound. But for this part, I observed a broncho-vesicular sound. Okay? Even though they're different, they are considered normal. Okay? So, for your breathing, we don't have problems, diba? Overall, for your breathing, for your respiration, we don't have problems. But with the structure of your thorax, we see a problem. We see a problem with your spine because it's not symmetrical. Because as far as I have observed from our assessment, it shows a sign of scoliosis. So for this one, to resolve this health concern, I would like you to go to a physical therapist and also to the doctor, to a physician that can help you with your scoliosis so that it will become symmetrical or vertically aligned again. Okay? For other concerns, I don't think you have other health concerns. So now, I'm just going to ask you if you have understood the summary of your assessment today.
Yes.
Okay. And do you also understand what you have to do so that your scoliosis or the deviation of your spine will be fixed?
Yes.
Okay. So, do you have any clarifications, questions, or concern? Nothing. Okay. So that's it, Rihanna. That's for our assessment today. Thank you so much for participating and thank you so much for doing the things that I asked you to do. You were very cooperative today. So thank you so much.
After patient contact, it is also important to perform hand washing because it is the leading infection prevention measure.
I have just finished assessing the thorax of my client. Now I'm going to record my findings on her client form. So this one is going to be important in the future when she deals with other healthcare professionals or when she have to do a thorax assessment again, because it states here what I found out during our assessment today. It will be stated here what's wrong with her or her normal findings.